Well, I have another question here from Michael Witt's fourth grade class from Alpharetta Elementary in Alpharetta, Georgia. Hey guys, this is what they want to know. Let's listen.
What would be a reason that would cause the Immigration Department to turn away an immigrant and send him home?
And were families broken up by the fact that some immigrants were turned away?
Studying too while they're asking questions.
It's a great question.
Good question.
Here at Ellis Island, we were worried about people making a living, paying their bills, and actually getting to their next destination. You were here at Ellis, but this isn't where you're going to end your visit. You're moving further into the country. So we wanted to make sure that once you arrived here in the United States, you could support yourself, you could get a job and pay your bills, and not be a burden to the people already here.
Also, one of the things I touched on earlier on the tour was the 6-minute medical examination. And I wanted to elaborate a little on that because our students are really interested in knowing about this medical exam. In particular, Daryl Bryan's fourth grade class from Palm Avenue Elementary. Hey guys, you guys are coming to us from San Bernardino, California. Let's listen to their question.
Can you tell us about what the doctors were looking for when they examined the immigrants?
I like the little lab coat. That's very good.
They're ready. They're ready.
Yeah, doctors actually played a huge role here at Ellis Island. So doctors are looking for two things. They were looking to make sure that immigrants entering the United States were healthy enough to work so that they could support themselves and their families. Two, though, they wanted to make sure that immigrants entering the United States didn't have any contagious diseases that they were bringing in. It was a huge fear. Still is, really.
Right.
100 years ago, at Ellis Island's time, they were really concerned about a disease called trachoma. So trachoma, most people have never heard of it unless they're studying Ellis Island, and that's because it no longer exists in the United States. It still exists in different parts of the world. It causes blindness, and it's very contagious. And back in Ellis Island's time, that was a big problem. To check for trachoma, you'd have to look at the underside of the eyelid. So that sounds kind of scary, mostly because the doctors would use what's called a button hook. It was never meant to be a medical instrument. It's meant to button buttons, but the doctors figured out that they could use this to help flip eyelids inside out.
They would use the actual hook to flip?
More like maybe the curved bottom part of the hook or the rod, just to kind of place it against maybe near the eyelashes, and then use the finger to kind of pull the eyelid up and over.
I was going to volunteer, but I think I'll pass.
Yeah, that's probably a good idea.
Yeah. Earlier I talked a little bit about the stairs of separation, actually, where immigrants were actually divided into 3 groups, depending on where they were going or, as I said, if they were being detained. What happened when immigrants didn't actually meet the requirements to enter into this country?
When immigrants walked down the center aisle, many were detained for legal and medical reasons. If they were detained for medical reasons, the United States Public Health Service would actually treat many of these patients at little or no cost to the immigrants themselves.
And so they would stay in the hospital here on the site?
Absolutely.
Almost like quarantine. But what if there were other reasons for them to be detained? What would happen then? Wouldn't there be, they'd have sort of the ability to be able to hear their case, right? So I know that we're sitting here in the hearing room, or what you guys call the Board of Special Inquiry, and there were, what I was told, 10-minute sessions in here where the immigrants were able to plead their case, right? And isn't it true also that friends and relatives could come and speak on their behalf? What happened in this room?
Well, absolutely. This is your second chance. If anything, any of the inspectors had a legal question about you, this was your chance to explain yourself further. And to help you, they would actually send a telegram to your final destination and invite your family or a representative or ask you to send a letter to kind of speak up on your family's behalf. So the alien, they're not citizens yet, would sit here, and 3 legal inspectors in the chairs behind us would follow up on that question that caused problems to begin with. We also had a recorder. We had to write everything down, which is why we know that on average they were 10 minutes, and a translator if needed.
So it almost feels like in here it was almost like a trial going on.
It really was.
Yeah.
It really was. The difference was that since you're not a citizen yet, you don't have any of the rights that we know and that many people came for.
All right. Now, I know, and we've talked about this, that there are a lot of common misconceptions about what took place here on Ellis Island, and there are a few myths that you would like to dispel. So we're going to play a little game. of fact or fiction. And you guys watching can play along. And the first question, or the first fact or fiction, is this. Fact or fiction. 20% of immigrants who arrived on Ellis Island were turned away and sent home.
Well, that is actually fiction.
Fiction.
So 20% were detained here. So about 1 in 5 of those 12 million immigrants did stay on Ellis Island for a little bit longer, days, weeks, sometimes months, where they would get medical care or wait for their hearing. Really only 2% were actually denied entry and sent back. So those other 18% eventually made it in. It just took a little bit longer.
All right, so I'm doing the math in my head. So 2%. So of the 12 million, about 250,000 were actually sent home.
Yeah, so a lot of people, but a small percentage of that 12
when you
million.
think about 12 million, yeah. All right, so here's the story. My great-grandfather, as I said, arrived from Italy. He came on June 18th, 1905. Now, my grandfather, my mom's father, swears that their name was shortened here on Ellis Island. So fact or fiction, was this common practice?
That also is fiction. So names were certainly changed, but not here on Ellis Island. Here on Ellis Island, the inspectors were looking at these manifests, these names that were written down already, and using that to verify information. So really, if there were misspellings, someone else wrote that. It wasn't the officials here. Also, many immigrants actually changed their names after they entered the United States, maybe as they became citizens, to just fit in a little bit more.
But you brought up something interesting, because the ship's manifest was what the inspectors were using, and there may have been a misspelling, or they may have had it may have been difficult to read the name.
Exactly, yep. They were all handwritten up through about World War I, and then they started to be typed. But still some of those same issues with typing.
All right, one more fact or fiction. Fact or fiction. Class structure affected the process for arriving immigrants.
Fact.
Wow.
Absolutely. The amount of money you could spend on a ticket made the difference. If you were in a first or second class compartment, you never even set foot on Ellis Island. You were inspected medically and legally on the ship itself. It's only those folks in the third class or steerage class that we were concerned about that came here to Ellis for a really thorough inspection.
So they were ferried over from the boat to the island.
Because those big steamships couldn't fit here in the slip.
All right, so we've been